Ever wondered what happens during an X-ray? Is it painful? Is it scary? Let me show you exactly what to expect step by step. Welcome to the world of radiology. I'm Isaac. I'm an X-ray technologist and also a content creator focused on producing educational content in the field of medical imaging. Here you will find easy to understand explanation on medical imaging, X-rays, CT scan and MRI and more, plus tips for radiography students and aspiring healthcare professionals. And today I'll walk you through the whole X-ray process so you could feel confidence for your next visit on the hospital. So when you arrive at the X-ray department or the X-ray unit, the staff confirms your information such as the body part that is to be examined, your name, your gender and other things, and he may likely ask you some clinical questions such as how are you feeling, sometimes palpating the particular organs to be examined, and the reason of doing that is to validate the X-ray request form given to you by the doctor or any medical practitioner. But don't worry, this part is simple anyway. So when you enter the X-ray room, you will see the X-ray machine, the X-ray detector, the table, the X-ray stand, the control panel and other things, but I'm sure it's not something that's gonna make you scared anyways. The one right here behind me, I hope you can see it. This is a conventional X-ray machine. So there are other different types of X-ray machine. There are other different type of X-ray machine, but this one right here is a conventional X-ray machine. So the radiographer or the technologist will position you depending on the part of the body to be examined. So you will be either standing, lying down on your back, on your chest, or sitting down on the X-ray couch, but it's easy. But talking of easy, it depends on the particular part of the body that it's to be examined. Because take for instance, the doctor requests for the scalar view of the knee. In that instance, you are expected to feel some pains, isn't it? So let's move forward. You are expected to feel some pains, definitely. So during positioning, I want you to know that teamwork is essentially required. Teamwork is essentially required. And when I'm talking of teamwork, I mean you as a patient and the radiographer or the technologist must have to work together as a team in order for the radiographer to achieve what he wants. That's during the positioning, because it's from the positioning that the radiographer or the technologist would get a very good output. So the radiographer is going to guide you, and you as a patient just need to follow carefully the instruction that is going to give you, and both of you must have to cooperate in order to get a very clear and good X-ray image. For some procedures like chest X-ray, when you're standing or in an erect position, you may be asked to take a very deep breath in before carrying out the exposure. It also makes the process feel friendly, easy, safe, and cooperative. So you will need to stay still and calm for some seconds. That's after positioning. Imagine when taking a selfie and you move, you know how the image looks, right? So same thing applies to X-ray image. Once you're positioned and when the exposure is taking place, once you make a slight move, no matter how small it is, it must alter the image, and the doctor may not be able to get what he or she wants from that image, or he or she cannot be able to dictate what is wrong with you on that particular image. So you need to be still and calm as the radiographer will give you that order. That's before he will carry out the exposure. There are different imaging modalities of which that is going to determine how long your result is going to be ready. So just know that the machine won't hurt you. The machine does not stay in your body, and the radiation, most importantly, the radiation dose is qualified and equivalently quantified. The exposure is fast, so you won't feel anything. You won't feel any pain. You won't feel any heat, you won't feel any vibration at all. So if needed, you will be provided with lead apron, and that is for protection. That I will explain that more and deeper in my next video, just to make this one short. Quickly, the radiographer will check the image to make sure it's clear and perfect. After that, you are free to go. Your doctor will receive the image later, or you will be given the image yourself to take it to wherever you're referred from, of which I will also make a video on that, which is image interpretation. So basically, that is exactly what to expect during an X-ray examination. So what part of the process surprised you the most? I want you to drop it in the comment section below, and don't forget to like, subscribe, most importantly, and share, in order for us to create a community of interaction for deep understanding and learning of healthcare and medical imaging practice. See you in my next video, exploring medical imaging across the world.